Hello, hello, friends. Happy Sunday. And welcome to Power Time with Sharon Herbert, the Power RN, coming to you live from Power in Nursing Innovations. So thank you for joining us today. And hopefully you've gotten a chance to meet me at somewhere along the nursing line in the last several years. We're still here and we're still working for you. So today's topic, of course, is about nursing. It's all about nursing. So, what do you think about nursing today, 2024? We've made it through 2023, but COVID's still here. But we have to take care of ourselves and each other. So make sure you remember that you are important and you are more than enough. So today we will be following up on our presentation from yesterday when we talked about empowerment for nursing and self-advocacy. So if you remember what empowerment and self-advocacy mean for nursing, just give your own self a hand. We've got to keep focus on making sure that nurses take care of nurses. We're good at taking care of other people. And as we talk about empowerment, that's one of the 3 goals of my Power in Nursing program. But what is empowerment for nurses? And it's not just for you, one nurse at a time. It's about the nursing profession. Because we've gone through some stuff and some changes since the COVID pandemic, and you might remember some things that were going on before the COVID pandemic that don't really exist anymore. Lots of policies, lots of changes. But how does that affect nurses? You have to take your own spot at the table to make sure that you are heard and seen by the powers that be, and that you have the advantage. Remember, you have the advantage of knowing who you are and what you do. And there are many organizations, even healthcare organizations, that have CEOs and executives that have no idea what nurses do. You even have people on your team, doctors, that don't know what nurses do. So make sure you keep focus on you and your colleagues. So, who's going to take charge? Empowerment requires taking charge. It doesn't mean harassing people and beating them up. It means knowing. It means it's a process. It is an enabler and supports you to take control of where you are, what you do, decisions that are made for nurses, your work environment, and advocating for your patients. You've heard of that before. What about yourself? What about yourself? Empowerment provides nurses, you and your colleagues, with the knowledge and resources and skills and authority to take charge of information about your roles and contributing to outcomes that are positive. They're positive outcomes for your role that affect the patients. But what about the positive influences on the role of nursing that can increase the potential and possibility of powerful and positive outcomes for the organization, for the patients, and for the community of nursing? No one can speak about nurses like we do because we know who we are. Have you ever come across folks who don't know what nurses do? And they might think they do. And they'll spin you a story, whether they're asking you what you do or they're telling you that they know what you do, and they're giving you a litany of things you do, scrubbing floors and changing beds and handing out trays, and they never spoke about thinking. They never thought about planning. They never thought about problem solving, education, none of those things. We've got to bring those qualifiers to the table. That, in essence, is the role of empowerment, my friends. You should know, and you should be able to tell your patients what you do and how you do it, and they may be surprised. But that's kind of okay, because if you have to do those same things in a forum with members of your healthcare team, whether it's the physical therapist, the x-ray tech, or your physician that is on rounds today, it's a problem. It's a problem. And we can't keep that a problem, because one thing we know for sure is that we are problem solvers. So let's stay focused on being empowered. Being empowered only comes from you. Now, some aspects of empowerment you should know. How do you get this information? And how do you get the knowledge to frame the solution to the challenges? Is that education? Education and training are part of our experience. To become empowered, you've got to pick up some of those resources. We're not going to talk about where you get them, but we do know that professional development and education are important. What about solving problems by going through those problems and making decisions on how some of those problems can be solved? If your CEO doesn't know what you do and how many of you it takes to do that thing, like turning over that 300-pound patient in isolation on the ventilator during COVID, how are they going to be the ones who determine the outcomes of the query on staffing ratios? These are the things that you know, and you are there to do those things, but you need the help of the team. The CEO and the CFO, they look at numbers, and they look at a lot of numbers, but they might not understand how it is that a 105-pound female registered nurse might need help to turn that 300-pound patient. In their world, they're thinking one nurse, one patient. Well, we know that's not true all the time. So help them to help you. You've made a decision that it's not going to be in your best interest, maybe mentally, but certainly physically, to struggle to turn that patient. You have to speak for you, but not only you. You and your colleagues. You and the community of nursing. And you might help your CEO understand what it is that you do. You have the authority to speak up, stand up. First, you must show up. Show up with the information that can help your CEO or other leaders make this a great relationship, working team that is able to provide quality, high quality care and best outcomes for everyone involved. We've talked a moment about professional development, and that is still key. How do you, as a nurse, find what is available, what opportunities you may find that can help solve the problem? And it's like doing a math equation. 1 plus 1 does not equal 1. And 1 plus 1, as your CEO will say, doesn't equal 3. Well, look at what's going on in the world, in the research, in webinars or conferences that you may attend. You'll find information that you may not know and may not have seen. Gather that and share it with your colleagues, and it may find you all a space or place that you can create your solution from what you've learned. And as we said, that's about advocacy. Yesterday's powerful presentation and experience reminds us that we must advocate, yes, for our patients, but also for ourselves. The healthcare wheel cannot run successfully without nurses. And we need each other to be the driver of that bus. We need each other. One may drive and one may be the buddy, might be the reading buddy, might be the buddy for checking off orders, may be the buddy for managing the medications. We have to do these things together because the weight is way too heavy for that one nurse to lift that one 300-pound patient safely. Not just successfully, but safely. Because the organization can't run without nurses. And if the nurses are not successful and turning the patient effectively, a whole lot of problems may extend from that one time that no one spoke out and said, this is not an effective way to keep the nurses healthy, because you need the nurses to do the work of caring for the patients. And the end of every math equation is an outcome. An outcome. Your CEO wants best outcomes. When those surveys come back from the state and or CMS, they want the best outcomes. And you want to be healthy. And you want to be well. Because we don't all just do this thing because there's nothing else to do. You became a nurse, and you're still a nurse because you love what you do. Absolutely. It is the passion. And you don't want to be a patient either. I've been one, and the first thing I thought was that I have to go home. I was in the ER and I was like, well, I have to go home because I have an interview for a new staff member coming this afternoon. The next time I was in the ER, I said, I have to go home because nurses can't be sick. We have too much work to do. And that is the truth, ladies and gentlemen. Have you ever been in the place where you thought, I've got to get out of here because people are waiting for me? People are waiting for you, and they need to know that you have their best at first. You will think about them, the patient, and if you ever become one, you'll think about your patients 3 times over to make sure they are well taken care of. And as we talked about teamwork, we have to collaborate. 2 things, and I'll give you 2 C's. I know that I talk about, acronyms, but we're going to leave it at collaboration and communication. We must share what we know. And as I say, sharing is caring. And caring, you cannot keep all of your answers to yourselves. If you don't share the answers with your colleagues, they won't know the answers. If you don't share the answers with your patients, they will call you all day, all day, all day. Do you have the answer yet? Well, do you have the answer yet? Well, do you have the answer yet? Set up a relationship with your patients. That is an agreement that you will work together to get the answers to the question. If your patient wants to know the result of the x-rays or when they're going to be discharged, set up an agreement for what you will do and do it. Give them a time frame, and make sure that you stick to what you say. That's the relationship that will allow you to finish your work today without answering the call bell 15 times. When you already have 5 patients and you're already behind because you have orders to acknowledge and you have notes to write. Make communication work for you. You have the authority to have a great communication with your patient. And if you tell them you're coming back at 12:30 and you're not back, that's going to be a problem. So give them leeway and give them a plan B. If you happen to have another experience with another patient who crashes, you can't leave that patient to go talk to Miss Jones about the time for discharge. Have a plan B. Before you leave Miss Jones, let her know that yes, you will come, your plan is to come back at 12:30, and that if you're unable to come back, you will have the tech come and let her know. And she'll be okay, because she won't be looking for you and wondering why you didn't tell her the truth. Tell the truth. And the same with your colleagues and with the doctors who folks are telling me, well, the doctor doesn't let me talk on rounds. Make it your business to really indicate the value that you have to the team as they don't know what's happening with the patient as far as where they live, or about her son coming in from 30 miles away and he has to take off from work and he's angry and he could be anxious. You have information that other members of the team may not have, which can change the outcome for the day. As you get your information back to Ms. Jones, and she shares with you that she's so thankful, and she says thanks again and again and again, and she lets her son know everything is cool, you get to do your notes and finish your day on time enough to get to your daughter's ballet recital. Whoa, wouldn't that be fabulous? Or you do get to that 7:30 dinner with your kids because you don't have to stay 3 hours to finish up the notes that you never really got a chance to complete because you kept answering the call bell. Advocate for you, yes, and for your patient. Now, that little scenario was one that can be so easy. Tell your patient who you are and come to an agreement about what you can do for that person, because the patient is a person and so are you. You want to get your work done because you live in care and service. You want to do a good job every day, a good deed every day. So make it happen. Make it happen, and you will find the value in being empowered and using your authority to make those agreements with your patients and with your colleagues. Talk to your leaders about some of these things that you may not have had a chance to even think about. You just have been spinning and spinning and spinning, and late and late and late. There are some things that we can do, really using what we've learned, like the nursing process. It is you acknowledge the problem and or the pain, and you complete the steps following to solve the problems. Now, everything isn't always solved, but this is a reminder. You don't go screaming and hollering without working through the problem and or the challenge. And you can get help. You don't have to do it all by yourself. Talk to your leaders. Find a mentor or a coach. There are many folks who are well seasoned and can help you. Don't think you have to lift that 300-pound patient by yourself. Be empowered to work through the challenge. You've got a slew of people around you, and empowering nurses is not only beneficial for you, but for the patients and for the organization. The outcomes are important for the patients, for sure, for the organization, and for you. We wish you success on each and every challenge to come, but we know that every day isn't going to be a great day. Something somewhere will happen, but prepare yourself to be ready to work through the problem as you are empowered to take the steps to do so. We love you here at Power in Nursing, and we expect that each of you will take a moment to think about empowerment. Empowerment. And we're not all just asking for money, and money and salary is important, but sometimes the path can be a little easier if you work a plan. Don't let it just happen to you same days after days after days, where your patients are angry and patients are calling you day after day, 15, 20 times, because they don't know what's happening. Or as they tell you, nobody told me. There are many ways to solve some of these problems. And you want to make sure you come out on the positive side as you are able and as you prepare for the days where there may be challenges. Find the answers for your patients and work together as a team. Empowerment for one leads to success, and success for others. So make sure you talk about some of these things as well with your leaders. Help your leaders by giving them the information that you just shared with your colleagues who were not at the conference that you went to. Share the information with your leaders. And leaders lead. That's their job. Help them to help you by giving them the information that you just received at the conference. Working together. Working together works. And as they say, teamwork makes the dream work. We thank you so much for visiting with us today. We will be back. And, as Arnold Schwarzenegger said, we'll be back. Because you need to be safe and healthy and well in your practice. New grads are coming, and you need to be in the mindset to help those folks be successful as well. Take them by the hand and help them to be successful. Joining us at Power Time. We'll see you next time. Be well, and of course you can find us on Facebook, LinkedIn, Instagram, TikTok, but you can email. info@powerinnursing.com, and you can DM me. The Power RN is always here. You can hit the button, send me a message. We are actually posing a launch in February, which is, February is next week. A new anthology. It is for you. It's for nursing. Tell your stories. Let people know who you are and what you do. And this will really be an interesting and powerful message for the new grads and new employees for healthcare that don't know what nurses do. Success in the stories. Empowerment matters. We'll see you soon.